Hello everyone. Today we are going to discuss about median nerve, its cause, branches and the innervation. First, you have to know what are the nerve roots of median nerve. Median nerve roots, median in the median nerve, the nerve roots are C6, C7, C8 and T1. Here in this picture, this is the lateral cord. This is the medial cord. You cannot see posterior cord here. This is the axillary artery. Then here you can see this is the musculocutaneous nerve and this is the ulnar nerve. This is the lateral root of median nerve. This is the medial root of median nerve. Lateral root of median nerve arises from the lateral cord. Medial root of the median nerve arises from the medial cord. You can see. Then those two roots united together to form median nerve anterior to the third part of the axillary artery. Axillary artery is divided into three parts as first, second and third. Here the median nerve forms at the anterior to the third part of the axillary artery. It continues along the lateral aspect of the brachial artery. Then from this axillary artery become brachial artery. Here you can see median nerve descends downwards lateral to the brachial artery. Then this median nerve crosses the brachial artery. Here you can see it crosses the brachial artery at the mid arm level, mid of the humerus. Then it goes medial to the brachial artery. Median nerve crosses from lateral to median to the brachial artery. At which level? Mid-arm or mid-humerus. In the median nerve also, there are no branches which arises at the level of arm. Then it goes to the forearm. Median nerve enters to the forearm between heads of pronator teres. In pronator teres, there are two heads as humeral head and ulnar head. You can see this part is the humeral head and this part is the ulnar head. Or this part is the superficial head, this part is the deep head. Humeral head of pronator teres arise from the medial epicondyle of the humerus. Here you can see median nerve goes in between this pronator teres superficial head and deep head. You can see this is the ulnar artery. Here this is the ulnar artery. This ulnar artery goes deep to the deep head of pronator teres. This is the deep head of pronator teres and this ulnar artery goes deep to the deep head of pronator teres muscle. So, deep head of pronator teres or ulnar head of pronator teres separates ulnar nerve and median, ulnar artery and median nerve. Deep head of pronator teres separate median nerve and ulnar artery. Then in the forearm, this median nerve gives off one branch called anterior interosseous nerve. Anterior interosseous nerve. In this picture, here this is the median nerve and this is the anterior interosseous nerve. Anterior interosseous nerve gives branches to lateral half of the flexor digitorum profundus muscle, flexor pollicis longus muscle and pronator quadratus muscle. That means in the forearm there are three muscle layers. Superficially there are four muscles. Superficially or first layer there are four muscles. Pronator teres, flexor carpi radialis muscle, Then palmaris longus, flexor carpi ulnaris. You know flexor carpi ulnaris is supplied by ulnar nerve. Therefore, the other three muscles in the superficial layer are supplied by the median nerve. Second layer is flexor digitorum superficialis muscle. This flexor digitorum superficialis muscle is also supplied by the median nerve. Then the third layer is the deeper layer which contain flexor digitorum profundus muscle, flexor pollicis longus muscle and pronator quadratus. In flexor digitorum profundus muscle, medial half is supplied by ulnar nerve, as you know. Then lateral half is supplied by anterior interosseous nerve, and also flexor pollicis longus and pronator quadratus muscles are supplied by anterior interosseous nerve. Closer to the wrist at the forearm, here this part, you can see median nerve becomes superficial, medial to this flexor carpi radialis tendon, and it gives a branch to the palmar aspect of the hand. This is called palmar branch of the median nerve. Then the median nerve passes deep to the flexor retinaculum through the carpal tunnel. After entering the palmar aspect, it gives a recurrent branch to thenar eminence. Here the recurrent branch, and then small branches to radial to lumbricals and cutaneous branches to palmar aspect of the radial 3.5 fingers or lateral 3.5 fingers. Here, after giving the recurrent branch to the thenar eminence, you can see there is one branch, another branch, and another branch. Those are the superficial branches, and they bifurcate here, and this is continuous, and here it is also bifurcate. Here it is also bifurcate. You can see this 3.5 fingers, lateral 3.5 fingers are supplied by median nerve, and also lateral 2 lumbricals are supplied by median nerve. Here in this picture you can see the cutaneous innervation of the median nerve in the hand. You can see 3.5 digits and palmar aspect, mid palmar aspect of the hand here, and also from the dorsal view here in this picture, tip of the fingers, 3.5 fingers here, this greenish shade, you can see tip of the 3.5 fingers are supplied by median nerve, while rest of the others, here this part is supplied by radial nerve. As median nerve goes through the carpal tunnel, the nerve can be compressed in carpal tunnel syndrome. So, in the carpal tunnel syndrome, there is no sensory loss in the mid palmar aspect because palmar cutaneous branch gives by median nerve before entering to the carpal tunnel. Before entering to the carpal tunnel, because this this branch is intact. But this innervation is not there in the carpal tunnel syndrome because the nerve is compressed. Therefore, there may be sensory loss or paresthesia over 3.5 fingers. Also, because it gives muscular branches to this thenar eminence, there is muscle wasting in the thenar eminence during carpal tunnel syndrome if the median nerve is compressed. And we can see the actions of the thumb are become weakened during compression of the median nerve. So that's all about median nerve and its clinical aspect. Thank you for watching.